We're here today with a special announcement. Our book, Conversations with Pam, The Power of Informed Healthcare, is finally available for purchase, and I'm so excited to start sharing it with the world.
Me too. This is very exciting news, and I've been looking forward to this day for 2 years now. But I have to ask, what was your inspiration for wanting to write this book?
Well, I've spent almost 3 decades watching patients and providers struggle in a healthcare system that prioritizes profit and protocols over people. During COVID, the cracks became impossible to ignore. We wanted to give readers a roadmap, history, context, practical steps to reclaim their role as active, informed participants in their own healthcare.
Our title includes the word informed in all caps. Will you explain what it means to be an informed consumer of healthcare?
Of course, our title, as you know, refers to our specialty here at Wellness Forum Health, informed medical decision making. The informed process means shifting from outsourcing health decisions to your doctor to learning how to do your own research, ask good questions, evaluate risks and benefits, weigh alternatives, and make decisions based on evidence, not instructions or even pressure. It's also about choosing practitioners who respect your choices and who take the time to engage in informed discussions rather than just writing a prescription and then sending you on your way.
In our book, we take readers back through more than a century of medical history. And I remember during our early conversations when we had just started writing this book, you kept saying to me, our problems didn't all just start with COVID. Go back 100 years and you'll see a series of events that not only explain how we got here, but also where we're probably headed if things don't change. And I now can understand why digging up all that history was so important.
Yes, it is important because today's problems didn't start with COVID. They just got bigger with COVID. Our current issues with healthcare are the inevitable outcome of 100 plus years of incremental policy changes, monopolistic practices, and cultural conditioning. Once you understand how organizations like the AMA, government entities like licensure boards, and the broadening of disease definitions, referred to as disease mongering, have influenced our system, it becomes clear why things are the way they are. While people are becoming more and more dependent on medicine, the system is becoming less and less reliable. Doctors and institutions routinely ignore informed consent laws while promoting tests and drugs and other treatments that often have no value. Consumers are saying enough is enough, and our response and solution is informed healthcare.
So back to disease mongering for a moment. You and I have talked about disease mongering quite a bit, which is a term I was unfamiliar with until I met you. It's provocative and spot on. So can you explain it a little bit?
Sure, disease mongering is the practice of expanding the definition of illness so that more and more people qualify for a diagnosis and treatment, whether they're sick or not. Terms like pre-diabetes and borderline hypertension are very good examples. The introduction of the pre-conditions has resulted in more and more diagnoses, turning healthy people into stressed out sick patients and fueling more and more spending and less real health.
What do you say to someone who feels overwhelmed by the medical system and doesn't know where to start?
Just get started. Read our book, for one thing, and decide to ask one more question at your next appointment. Request the actual risk benefit data for a drug or procedure. Take the time to think about any suggested treatment before saying yes. These are simple, doable steps that shift the power dynamic immediately.
And even though we're pretty hard on institutional medicine throughout the book, we are not anti-medicine or anti-doctor.
Not at all. We're not against doctors or science or healthcare in general. We're against bad practices and blind compliance. Informed consent, critical thinking, and individualized care are supposed to be the backbone of medicine. We're simply calling for a return to those principles.
Who do you think should read this book?
Anyone who interacts with the healthcare system, patients, families, practitioners, policymakers, if you've ever felt rushed, unheard, regretful, or unsure about a medical decision, this book gives you tools and context to start navigating the system with confidence.
How can healthcare providers benefit from reading this book?
The book offers a candid look at why trust is eroded and how practitioners can both escape the system and rebuild trust with both patients and the community at large. Informed providers who respect and encourage informed discussions stand out and thrive in this new culture of empowered patients.
And you've mentioned several times in our discussions that the tide is already turning and there's a huge cultural shift taking place that's been building for a long time. So where are you seeing signs of hope?
Well, more patients are asking questions, more clinicians are choosing independent practice, and communities like ours are forming to share evidence and support one another. That's how real change starts, and it's going to happen from the bottom up, not the top down. In other words, government is not going to fix this. We are going to fix it.
So what's one takeaway from our book you hope every reader leaves with?
Well, you, the people, have far more power than you think. When you're informed, you change not only your own healthcare outcomes, but the entire system, because the system can't exist without compliant consumers.
That's right. And this is where we'll leave our discussion for today. In order to purchase your copy of Conversations with Pam, The Power of Informed Healthcare, click the link provided. We truly hope you enjoy reading our book, and we hope it'll inspire you to join our community of informed consumers. Thank you so much, Pam.
Thank you, Heidi.